One of the most frequently asked questions we get is, my child's nervous and has cavities. How do you guys help the little ones in this process? We have a staged approach, meaning depending on the child's level of anxiety and the amount of treatment, that will ultimately dictate what we can do. And obviously we want to be as conservative as possible. And so we would start out as simple as using a little laughing gas with nitrous oxide. Nitrous oxide is wonderful. It slows down the levels of anxiety. It blocks pain mildly. And so it allows us to do a lot of dentistry without the child having a traumatic experience. And often we're fixing teeth without local anesthetic, which means no shots on a young child, just using laughing gas. We have TVs in the ceiling. Distraction is a huge part of the game we play. And if we can get the child thinking about something else besides what's going on inside their mouth, and it's comfortable for them, odds are they will let us provide the services that are necessary. Say your child is a little more anxious or has had previous dental visits that have been less than favorable. We can do what's called a moderate sedation or conscious sedation, which is where we have your child drink a mild anesthetic, or there's an option to squirt that anesthetic in their nose. Some kids refuse to drink the medicine. It does taste a little funny, and so there are ways to deal with that. We use this type of technique for a child that has 2 or 3 cavities, but is very, very anxious. The anesthetics have amnesia properties, so although their eyes may be open and may be watching what's going on and have some awareness of what's going on, they typically will not remember the sedation procedure. If your child has multiple cavities and is very young and it's not age appropriate for them to be seen and have the teeth treated here in the clinical setting, then we would invite an anesthesiologist into our office or look into medical coverage and see if we can get access to a hospital setting or a surgical center. I have privileges at both Utah Valley and Orem Community Hospital, and also at a local surgical center. And our anesthesiologist that comes into our office is an MD anesthesiologist that has been in practice for over 20 years.